Focus. Ideate. Innovate. Enable.
Welcome to Live Well with Diabetes. I'm Devina Lasson. Through this series, it is our endeavor to spread awareness about diabetes, establish facts, and dispel myths. We've traveled the length and breadth of the country to meet with leading medical experts to go in-depth about diabetes and its complications. Today, on our series finale episode, we're coming to you from Mumbai to discuss pertinent issues and the best possible ways to stay healthy with diabetes. Joining me today on the panel are Dr. Ambrish Mittal. He's the chairman and head of endocrinology and diabetes division at Medanta. Dr. Shashank Joshi. He's a consultant endocrinologist at Leelavati and Bhatia Hospital and Joshi Clinic. And Dr. G.R. Sridhar. He's the director of Endocrine and Diabetes Center, Visakhapatnam. And all three of our doctors are former presidents of the Endocrine Society of India. Doctors, welcome. It's a pleasure to have you here today. Thank you for joining us. Dr. Mittal, I'd like to start with you. So India has been known to be sort of the diabetes capital of the world. Given this fact, how can people who have not yet been diagnosed predict the likelihood of getting diabetes?
So India is not incorrectly known as the diabetes capital. Actually, diabetes is threatening to overrun us. And in metros, for example, overall prevalence of diabetes in adults now is above 20%. Wow. And if you go to the age of 60, for example, you have maybe 40% people who already have diabetes. And to this, if you add another 30% or so who are in the pre-diabetes zone, in the sense that they are on their way to becoming a diabetic, you actually have 70% of population that is either diabetic or on its way to becoming one. So it's very important that we really find out who are these people. And some of the ways we can predict our risk is definitely those who have a strong family history, those who are overweight or centrally obese, for example, women with a waist circumference more than 80 centimeters, men with a waist circumference more than 90 centimeters, or higher body mass index, those who are physically inactive or sedentary lifestyles, those who have problems with their blood pressure, problems with cholesterol. All these people are more prone to develop diabetes. Sure. So really, everyone has to watch out and take steps from reaching there.
Absolutely. But Dr. Joshi, is it possible to sort of reduce your risk and reduce the likelihood of getting diabetes in the first place?
Yes, absolutely. Because if you know who is at risk, and how do you know who is at risk? So if you have a family history, or if your waist circumference is more than 90 centimeters in men, 80 centimeters in women, then you should screen them early. Right. From 20 years, you should start ensuring that you screen them and check your blood glucose. Because most of us don't know that we have diabetes unless until we check it. Right. So it's called as an at-risk strategy. And I think universal screening after 40 should be mandatory. As Ambrish rightly said, that we need our geriatric population to be screened every year, whether they're getting diabetes or not. So you have to wait, after 20 for people who are at risk, after 40 probably every year or every 2 to 3 years, and after 60 probably everybody.
And is that the same for men and women both?
Yeah, I mean there's no really gender bias in diabetes.
Younger Indians also getting more diabetes. Right. Very important for those who work in the corporate world, in large corporations, that people in their 20s are getting that kind of diabetes that we used to see at 40 or more. So the age of onset has come down.
But Dr. Sridhar, talking about the correlation between your family history of diabetes, what is the connection of genetics and diabetes? Is it a guarantee that if it runs in the family, it will be passed on to the future generations?
Just because you have a gene, it's not that you are going to get diabetes. They used to say genes are like loading the gun. You still need to operate the trigger, and that operation is the lifestyle. So previously they thought if you have a certain set of genes, you identify them, you can correct that. But now it has become a lot more complex. Yeah. So you find that even lifestyle can change genes. Absolutely. In other words, just because you have a gene, you don't get diabetes. There are of course newer aspects such as neonatal diabetes or rare forms, where when you have an abnormal gene, it can be identified and it can be treated by means of tablets rather than insulin. Okay. So what genes are going to do is they are improving our understanding of why we get diabetes. That way you can treat the diabetes in a better way rather than saying that you have this gene and then you are diabetic.
Dr. Mittal, coming back to you, can you tell us what is the importance of monitoring your HbA1c levels? In addition to your fasting and your post-meal sugar levels, what is the importance of monitoring the HbA1c levels?
So monitoring is of essence in diabetes because symptoms don't show up. So to figure out how well you're doing, you need to check your numbers. And the numbers, there are several numbers, but for assessing blood glucose, of course, fasting and post-meal glucose is important, but there are only 2 points in a day or in a week or when you check actually. Whereas HbA1c, or glycosylated hemoglobin as it's called, has become a gold standard because it reflects the average blood glucose over the past 3 months.
Right.
So if you're looking at an average glucose control over the immediate preceding period of last few weeks or months, then HbA1c is a great marker.
Dr. Joshi, we've touched upon this, but let's really put a focus on the importance of lifestyle management with diabetes management. Is it possible that if you manage your lifestyle well, you can even reduce the quantity of diabetic medication required?
Absolutely. I think if you just eat on time, if you eat the right things, if you eat appropriately, you do behavioral change in your habits, because habits die hard. Okay, sleep on time. If we can do small things which can make meaningful changes in our day-to-day activity. We have to be physically active. Now, it doesn't mean that you have to do exercise, we just do a brisk walk. People don't have time to do a walk, but they can be fidgety. They can walk when they talk on a phone, and they can do small spells of 5 minutes, 6 times or 8 times a day. They can just walk and step. They can have a stepper. We have all these new apps which are ensuring that we walk more, we step out more, we do exercise. But remember one important thing in lifestyle for Indians. We have less muscle mass. Because we have less muscle mass, that is why we are always number 4, whether it's a PT Usha or whether it's a Milkha Singh. We are not having adequate muscle. We are thin fat Indians. We have more fat, less muscle. So we need to do some muscle strengthening exercises. Right. If you really want to make a lifestyle impact on diabetes, both in management as well as prevention. And therefore it's important to do some good physical exercise. And also remember, impact of medications becomes better when you integrate it with lifestyle.
Even if you're exercising regularly, if you're sitting for prolonged periods, and doctors are the biggest culprits in that, sitting for prolonged periods has a deleterious effect, even if you're exercising in the morning. So sitting, as it is said, is the new smoking. So even if you're at your desk, it's good to get up every half an hour, every 1 hour at least, for a few minutes, walk to a neighbor's desk, chat something and come back.
Be fidgety. We call it a new term called NEAT, non-exercise activity thermogenesis. Okay. And Indians have a NEAT which was 2,500 of our agrarian Indians. It has come down to 700 just because we have to sitting sedentary. But Sridhar?
Again, physical exercise is not just running or doing exercise. That is good for the heart. You also need to do stretching. And it's here that yoga helps. And it also relaxes. And as Dr. Shashank said, you need to build your muscles.
And we also need to not do it under stress and time pressure. We need to smile, take it easy, relax. Because, we are the argumentative Indian. Yeah. So we are always having Josh. But with Josh, we should relax, take it easy.
Calm down a bit.
So, Sust and Must and Josh has to be mixed appropriately.
Sridhar, amongst diabetic patients, it is often a thought that once you have diabetes for a prolonged period of time, say 10 years, the thought is that insulin therapy will be inevitable. Now, how pertinent is this worry, and can it be avoided or postponed in any way?
Put it the other way around. We should be happy that we have insulin which acts when all other drugs fail. And the beta cells which produce insulin, they age like the rest of the cells. And it's only a matter of difference, whether it is 1 year, 2 years, or 5 years, or 20 years. So whatever treatment we do, either physical exercise, lifestyle, diet control, or some of the new drugs, they can reduce the rate at which the beta cells fail. In that way, it helps, both for immediate control as well as for the beta cells to act for a longer time.
Dr. Mittal, another concern amongst diabetics is that the medication might in fact lower their blood sugar levels. Again, how pertinent is this issue, and can it be prevented in any way?
So it's important to remember that preventing low blood glucose reactions is as important as controlling high blood glucose. So we have to manage diabetes in a fashion that doesn't allow high or low glucose. Right. Now, to do that, there are various lifestyle things, eating on time, taking your medicine on time, not varying your diet too much. But there are also newer medications that do away with the problem to a large extent.
Right.
So in fact, new drug developments in diabetes have focused on drugs that don't cause low blood glucose.
Okay.
And also perhaps help in weight loss, or at least don't cause weight gain. So the focus in diabetes management has moved from just controlling glucose to having agents that will prevent low blood glucose as well as not promote weight gain.
Sure. But these newer medications, are they quite accessible and quite available to all?
So it's happening. It's happening. Of anything that comes in new is patented and is obviously it's higher priced. Over a period of time, drugs that we thought were rare and expensive 10 years ago are freely available now.
Yeah.
So there are steps in the right direction, and I'm sure they are becoming more and more accessible, and over a period of time, they'll be easily accessible to most of our population.
Right. Dr. Sridhar, let's talk about the correlation between blood pressure levels in diabetics and the level of diabetes. How does it affect it? Does it make the case worse?
You find that diabetes and hypertension occur together. So you need to manage the two of them. There's no doubt about that. As they say that if diabetes is here, can hypertension be far behind? And what Dr. Shashank and Amrish had said is to look at it holistically. You need to look at the blood glucose values, the blood pressure, cholesterol. And then you have to treat all of them together. Because when we looked at our own patients, I found that just about 15% had elevated blood glucose alone. The other 85% had associated elevation of blood pressure, high levels of cholesterol. So when you manage diabetes, you have to look at hypertension, you have to look at lipids. If you don't do that, you find that the risk of getting vascular disease doesn't come down.
So it's like an ABC, A for A1C, keep it below 7, B for blood pressure 128 and below, and LDL cholesterol, try to keep it below 50 or 70. The trio of ABC is very critical to manage. And diabetes management is not about diabetes alone. As Professor Sridhar rightly said, it is also about blood pressure and cholesterol.
Absolutely.
And then you can have an impact.
Absolutely. Dr. Mita, let's talk about the effect of vitamin D levels, the fluctuation of vitamin D levels in diabetics. How does this affect diabetics and, say, bone health, for example? What is the correlation?
Diabetic patients or people with diabetes are more prone to fractures. So this is a recently recognized phenomenon where it is clearly shown that people who have diabetes are at greater risk of osteoporosis and fractures related to osteoporosis. And the reason for that is that diabetes can affect the quality of the bone. So it's not just bone density per se, it's also bone quality that is impacted by high blood glucose and by diabetes. Vitamin D plays a role in overall bone health. It doesn't really have a absolutely proven specific role in the diabetes context per se, but it's very important that diabetes patients maintain normal D levels so that their bones are protected. As it is, they are more prone to getting osteoporosis. So in fact, the risk of fractures varies from 1.5 to 2 times, like 1.5 to 2 times more in those who have diabetes. So it's an area that has got a lot of attention now, and preventive strategies for preventing falls and preventing fractures and improving muscle mass have become the order of the day. So that's another area where we need to look after our diabetes patients.
More than diabetes, vitamin D deficiency is more important. And the way you identify low level of bone mass is by DEXA. Patients with diabetes have thick bones on shadows, but they have the risk of fractures. So that's a very important.
So that's very important, that they may not be having the conventional low bone density, yet their risk of fracture may be high because the bone quality is impacted here.
Dr. Joshi, let's shift focus now to a recommended diet for diabetics. What is sort of the ideal diet plan, and also specifically looking into the kind of oil that should be used, especially given our Indian cuisine and the use of oil in our cuisine. So what oils would you recommend as well for diabetics?
So diet, we love food. And to make food tasty, we need to cook it, fry it, and we have unique Indian cooking tastes. So we need to eat less, we need to fry less. We need to cut our carbs and fats because we eat too much of carbs and fat and we have less protein. So that's the basics. Now you come to a very important point, edible oils. Remember, no edible oil can cure or treat diabetes at all. So all that is a sham. Okay. Having said that, you should cook in less oil, less than half kg per person per day. We have done cutting edge research on oils where you need to mix PUFA and MUFA. You will also remember olive oil cannot be fried, and it is not an Indian cooking oil at all.
Right.
We blend oils and then cook in less oil, so they are stable when we are frying it. Indian cooking conditions have temperatures of 150 to 200, and then we have the tadka and the spice going on it. So obviously, we generate a lot of free radicals, and we need them to be stable and with antioxidant systems. So antioxidants may not be useful for our body inside, but when we fry, they are necessary. Also, the shelf life of oil has to be recognized. So cook in less oil, have a blend of oil like a 30-70 blend of rice bran with the safflower, so that we mix and match. No oil is unique. You need to have a blend. And ensure that we don't use some of these foreign oils. Also, having said that, the bigger poison is not the fat. The bigger poison is the carb. Sugar is the bigger poison. And we all know that sat-fat research, now we know sat-fat is okay. You can have the whole egg. You can have the egg white and the yellow both. Because the yellow is not as bad as it has been projected to be. Because that was all funded by the sugar industry. And therefore, we have to be very cautious. We have a sweet tooth. We need to curb our total quantity. Portion control is most important. Eat less. Ensure that we cut our carbs and cut our fats and cook in less oil and use better cooking medium. Another important thing about oils is do not reuse oils.
It has to be put in perspective. There's a lot of changes in the field, but I think I completely agree with what Shashank says about moderation. So it's about portion size, it's about reducing your fried stuff, reducing simple sugars, that's critical.
Right.
That's critical. And even though saturated fat has been sort of, it's not so much the villain anymore, we should still go low on saturated fat as much as possible and certainly completely avoid trans fats. So I think saying that one particular fat is okay and one particular fat is bad, one oil is great and the other oil is bad,
balance it
is
out.
really not...
Balance and blend is the current trend in oils.
The most important thing is cut down on the amount of oil. Yes. What some people say is, I use brand X and then they use 2 kgs per head.
It's all
not the point.
Less than half kg per person per month.
Dr. Sridhar, talking about sugar levels, let's talk about the issue of fruits. And do fruits contribute higher sugar levels to one's diet?
There's no clear yes or no answer. For the pre-diabetes, in fact, they say it's better you have fruits because fruits have fiber, fruits have antioxidant properties, and then they tend to fill. So those people who eat more fruits, they have lesser chance of getting diabetes. And even in diabetes, if you eat an apple, you won't die. It's not as bad as that, but you have to be cautious. As Dr. Ambrish said, we have to be having a balance of the kind of food we eat. Suppose a person has got diabetes under control, is able to manage well, then a serving of fruit is good.
But a fruit juice is harmful.
Yeah.
The biggest problem is not the fruit.
The whole fruit.
The whole fruit is good. It has fiber, as Dr. Sridhar said, but the fruit juice is the poison. Because for one fruit juice, you are actually crushing 7-8 fruits, and that's far more dangerous.
Yep, absolutely.
So traditionally, sometimes we think that juices are very healthy actually, but in a sense, from the carb or diabetes point of view, juices may be as bad or at least almost as bad as colas and others.
Right.
So you need to be careful about that.
So diabetics must be cautious when consuming fruits and certainly not fruit juices. You must be very careful. Right, Dr. Joshi, on a concluding note, can you tell us about any new therapies that exist for diabetes management and where are we going in this direction?
So, we have to live happily with diabetes, and I think diabetics have far more choices and doctors have far more choices. Dr. Mittal started that for low sugar attacks. Now we have medicines which don't cause low sugar attacks, and we also have medicines which don't cause weight gain. In fact, we have medicines which cause weight loss. So we have 2-3 unique therapies available now. We have oral tablets which don't cause low sugar attacks and are weight neutral. They are called as gliptins. Then we have medicines which pump out the sugar in the urine and also cause weight loss and no hypoglycemia. They are called as SGLT2 inhibitors, glifosins. Yeah. These are the 2 big new drugs which are available in India and they have outcome data on them. And they are very safe. Safety is the only challenge we have. Also, we have injections. Now, insulin, we know the biggest fear of people with insulin is injection, but it causes low sugar attack and causes weight gain. Right. Now, we have injections called GLP-1 analogs, which can be used once a day, twice a day, once a week, once a month, and now maybe a device which may be once a year, which will again not cause low sugar attacks and cause weight loss. And these are called as GLP-1 analogs. And all of them are also either available or likely to get available and have good data on them. So a diabetic's life is far more better. Okay, we also have designer, these PPAR gamma agents. So many of the new drugs, we have better molecules available with lesser side effects. We of course need pharmacovigilance because every new drug which comes, we need to be vigilant about them for the newer and newer side effects. But I think a diabetic's life is far more better than what it was maybe 30 years back.
You have to still individualize therapy. And not every drug is for everyone. And you let your doctor choose your medication for you. Combine the correct medications because diabetes is all about combinations. And I'm sure you can achieve your targets pretty well.
Fantastic.
And what we need is how to utilize information we already have. You stop smoking, don't gain more weight, do physical exercise. We've known this for a long time. But the only difficulty is it's difficult to put into practice.
Absolutely. Well, doctors, thank you so much for joining us today. It's been a pleasure. And thank you for being part of the series finale episode. Thank you. Well, that brings us to the end of our special series, Live Well with Diabetes, with valuable lessons learned from medical experts across the country on diabetes, its complications, and the best possible ways to live healthy with diabetes. I'm signing off. From the entire team, many thanks for watching.
Focus, ideate, innovate, enable.